Okay, I'm Lisa Ruffalo, and I am going to be in charge of managing a project. The project that I'm going to be doing is implementing a critical care pain observational tool. The reason I'm doing this is because during a meeting in the ICU, our patient satisfaction survey was very poor in pain management for our previously intubated patients. More than 80% of them remember having pain and remember hearing us, but not, receiving anything for pain. Not that we didn't, but all that they can remember and relate to is the fact that they had pain. So, the background of the critical care pain observation tool is it's one of the fewest used behavioral scales, but was developed and validated for the purpose of detecting pain in the nonverbal critically ill adults. Um, the thing is we use a behavioral pain scale, which utilizes facial expression, upper limb movement, compliance with ventilator, and those are your only three. And you score from a 1 to a 4. A total of 3 would be no pain at all, and a total of 12 is the max, which that would reflect some sort of pain. And it would be our job to give them something for pain. Studies show that you should not rely on vital signs alone to detect pain, such as high blood pressure, tachycardia, which is a fast heart rate, because there are instances where people can be in pain and those don't deviate from the normal. So the difference in the behavioral pain scale, the critical care pain observational tool, which is CPOT, has one more thing, and that adds a description of muscle tension. So by stimulating them and them contracting muscle, grimacing, anything with facial movement adds another score. And it's been shown to help um, with pain assessment. So the objective of my project is aimed at completing a pre and post evaluation of the implementation of the CPOT on pain assessment and nursing management practices in the ICU with nonverbal critically ill patients. I told you why I chose this project because of our pain satisfaction scores being down. The design is my design for it is just going to be a before and after study. The setting is going to be in our ICU in a local community hospital. It's a 20-bed patient ICU. The project team is going to consist of the staff, all of our nursing staff, days and nights. They're all registered nurses. A full-time physician who is board certified in pulmonology, and he also is our ICU intensivist, and he's in charge of all the ICU orders. And the reason I want him on board is because with this new pain assessment scale, if we are finding that we are able to evaluate pain in a more positive way, if we're actually assessing that there is pain, he will be responsible for changing the ICU protocol and adding on pain medication. Not only adding on pain medication, maybe adding on morphine 4 milligrams versus 2 milligrams, and increasing the frequency that we can give it every hour for moderate to severe pain versus every 4 hours for moderate to severe pain. So the staff nurse is the physician, an IT consultant, and she will be in charge of coordinating the software during the implementation phase. As far as adding the feature of the CPOT onto the the electronic health record. Right now all we have is the BPS. I'll act as the project manager. I'll be the educator to the staff, the auditor of the pain assessments being done, making sure that our nurses are being compliant with the assessment. I want it done. We document every 4 hours and as needed. Pain assessment, post-pain assessment is supposed to be done an hour after. So I'll just make sure that that's being done as well. And I will also act as a super user, so anybody that needs help with how to assess for this new pain scale, I will be there. And there will be one more staff member who I will delegate the task of being a super user for on the days that I'm off. She will be there to help. The implementation will include 3 steps, which is going to be the pre-implementation phase, the implementation phase, and the post-implementation phase. And during the implementation phase, the staff, we have 42 nurses through our day and night shift. They will attend standardized training sessions on the use of CPOT, and they'll do practice by video. So they will watch different scenarios of patients in certain types of pain, and they will score, and they will be graded on how they scored, and the rationales will be there. The post-implementation phase will evaluate the use of the tool compared to previous, and will also evaluate the use of analgesic and sedative agents that are administered. Studies show actually that when you use the CPOT in conjunction with the behavioral pain scale, that you actually decrease the use of pain medicine and sedation because when you anticipate the needs, you're a little bit more gentle with the patient, you reposition them more, and it keeps them out of pain. The goal is to have positive effects on pain assessment and nursing management of patient pain. And of course, the best case scenario is the improved pain control on the patient surveys. I just want to add that the reason I believe this is so important is because many critically ill adult patients experience significant pain during hospitalization in the ICU. More than 50% of them have significant pain at rest. And this is when they are not showing any signs and symptoms of pain, but inside our sedated patient's mind, and their physiological system, they are experiencing pain. But because they are on some form of sedation, being ventilated, they're not able to verbalize this or move their arms. And a lot of them are restrained when they're intubated, so they can't, point or, we ask them to squeeze our hands. We do ask them to nod their head yes or no for pain, but if they're under a lot of sedation, to keep them calm, it's extra hard to assess it. They still do grimacing though. That's why the CPOT pain scale is useful, because it adds the muscle contraction tension scale. So more than 50% of them have significant pain at rest, and more than 50% have significant pain during the course of their stay. And during the course of turning or endotracheal suctioning and wound care, they experience a lot of pain that they can remember, and this is how we come up to this conclusion. So stakeholders in this project are, they're going to be the patients, the physician, and the nurses, and then the IT consultant. They all have a significant role because stakeholders can be as varied as individuals. They could be the individuals, the patients themselves, groups, organizations that have an interest in the project, and anybody who can mobilize resources to affect the outcome are going to be the stakeholders. Budget-wise, I'm going to include our manager of the ICU. She's, she knows the budgeting. I'll get with her, talk to her about what's affordable, what they set aside for budgeting as far as CBTs, and allowing nurses to come in on their off days, maybe have a class. I didn't want to utilize the ClinSpec for education because it's not that extreme of a teaching that needs to be done in order to learn this, but that's what it is. So there you have it. My project will be implementing pain assessment. Thank you.